your boy, Tommy D, the nonprofit sector connector. And I got to just tell you, you know how I love the hats, you know how I love the hoodies. I just got to tell you, I'm representing today for the Mental Health Association, Nassau County. This I got at the Gone But Not Forgotten Walk, which is out of Jones Beach. It says overdose prevention and awareness walk, gone but not forgotten. And I think that's incredibly important. You know, I'm on a mission. I do another program called #Ending the Stigma Together, ending the stigma around mental health issues, serious and persistent mental illness. I tell you, I see my therapist twice a week. I love that time, actually. It's incredible. Talk about mental health. We talk about people struggling and battling with addiction problems. I tell you, I'm sober. 15 years, I tell you that as well, right? I tell you all these things because I think we break down walls and we break down barriers, and then I also like to wear hoodies. So if you are a nonprofit and you want me to wear a hoodie, just let me know. I'm happy to do it. Shout out to Jeff McQueen and the team over at Mental Health Association for Nassau County, all the work you're doing. Let's get into it. Today, my guest is Tamisha Walker from PM Pediatrics. I'm glad you're here. Hello, my dear.
Thanks, Tommy. Thank you for having me.
I'm glad you're here. This is exciting because I remember when we first met. Do you remember when we first met?
I do.
We were at
Bayside Business Association.
Yes, exactly. You know, and I think one time too, the Queensboro president was speaking in the back of Ben's Kosher Deli.
Exactly.
You remember that?
I do.
And we were like sitting back there, and we were learning about just things in community and stuff, and you and I had an opportunity to speak. And I'll tell you this, I'm very familiar with your brand, but I want everybody else to be familiar with it because I'm very familiar, because similar to you, I'm raising kids, right? Mine might be smaller than yours are at this point, but children, boys I think especially, do knucklehead things, I would say. And I spent a lot of years like going to urgent care and certainly PM Pediatrics. You know, there was one that used to be on Northern Boulevard.
Right.
Certainly up in Bayside, which is Bayside Business Association, sort of our whole connection there. But for folks who don't know, I mean, we're going to get into your role and community outreach and the engagement and stuff. But what is PM Pediatric? What makes it different? What's the connection?
Yeah, so PM Pediatrics is a pediatric urgent care, and we specialize in pediatrics. So what's different than other urgent cares is we have pediatric physicians, pediatric ED trained physicians that can really take care of your child's needs. Not only do we see children in general, but we see ages what we call 0 to 26. So we can really, really look into the scope of the children. And in addition to our urgent care services, we also have mental health services that we're now providing for the community.
I'm so happy
and
about
also
that.
School health services in Suffolk and Nassau County. So I'm really proud to say that.
I kind of know how things are going to go sometimes because I know like the mental health conversation is so ubiquitous now, and I love that it is, honestly. It gets me emotional because we need to normalize these things, and especially with our young people. And while this is not the show, the whole set is different when we do this other show, right? But while this is not that show, right here with me sat leaders of the North Shore Child and Family Guidance Center, and we were talking about AI and social media and mental health in our young people. So obviously as a health organization, it's going to come up because it's not just I stubbed my toe, I broke my arm, I have a fever. It's I also am having different challenges on the mental side of things, you know? So I'm glad you brought that up. Why don't we talk about that? Because I wanted to ask you about community outreach and connections to the community and your role in the organization. So let's just identify your role and then talk about that mental health, because you mentioned schools, and I'm sure that's a big part of what you're involved with.
Right. So I am the Regional Operations Director for PM Pediatric Care here on Long Island, Queens, and in New York City. PM Pediatric Care does have over 85 offices across the United States, but there are 12 between Long Island and Queens, 7 right here on Long Island. And we do offer, like I mentioned, mental health services. We have a standalone practice right here in Rockville Center that specializes in mental health services for kids.
I didn't even know that. I had no idea. I'm so glad we went there.
Yeah, and what's great is exactly what you just mentioned. Like, I have 2 sons. They're college age, right? But we all go through things. People go through divorces. School just started. There's anxiety with school starting. We always deal with bullying and just general anxiety. I'm no mental health clinician, but I'm very aware of all the things that children go through, just in life, anxieties, and just things with the world right now that may be affecting their parents, their home life, how they learn in school. So the support is often needed.
Yeah.
And in certain communities, there is a stigmatism.
Yes.
And it's really hard to kind of break through that. But it's awesome when services can be provided on site in physical brick and mortars like we have in Rockville Center, or virtually, as we're able to do the same.
Yeah, thank you for that, and thank you for giving me the context. So that's like a standalone facility just for mental health services.
It is.
That's great. And you mentioned something. So you say you're not like a mental health specialist or professional. Guess what? Right. Neither am I. But you know what we both are? Human beings.
Absolutely.
Who have human interactions all day, whether virtually or in real life. We're constantly, right? And
exactly.
And we're of an age where we've seen a lot of things already, right? We're probably going to see a lot more, right? But we've seen a bunch of stuff. So I think it's okay for us non-clinical people, right, from a mental health perspective, to be all about it. Because I see people and connect with people all day. And I always say, everyone you meet is fighting a battle you know nothing about.
I love that.
Right? Isn't that
so true?
Isn't it? Because and I have to remind myself, even though I'm the guy that goes around saying it, I have to remind myself that I say that, because there's people in my life, often the people that are closest to me, that I forget to give them that same courtesy. And I say that humbly to remember that, because we have to just, and if we greet people there with love and compassion, I think we're better off.
That's the key.
Yeah.
I believe in that.
Thank you. So with not having a background there, do you have a clinical background in healthcare? Like, how do you get to PM Pediatric? What's that journey like for you?
So I've spent most of my career in healthcare. I actually started out on the patient access or patient revenue side, doing like billing, insurance claims, really helping people to understand insurance and what that approach is. For a little bit over 15 years of my life, I worked for Memorial Sloan Kettering Cancer Center.
Wow.
But I'm very proud to say that my career was here on Long Island. So I was here in the Comac locations, the Nassau County locations, really being able to outreach on Long Island, doing the breast cancer walks.
Wow.
I'm also a breast cancer warrior right now for myself. So, I was able to access the community in that way.
Yeah.
And that really instilled the love and the understanding that, healthcare, we're here, right? But there's also a people approach to things, and really letting people know that, outside of these walls that you're coming to for treatment or to get sick or to get help, to get better, we're here for you. Right.
I think, it's interesting because where we're sitting right now happens to be on the campus of Northwell, the cancer center. And I'll just say I've had some family members who've had to come through here. And, there's one thing. So, wow, I didn't know I was going to tell this story. So, a couple weeks ago, so my business, we own an employee benefits agency, Vanguard Benefits. So we had which I told you about this, dinner we had with Northwell Direct, right? And we had this dinner, and the team at Northwell Direct, which is the carrier, the provider network of Northwell, that we as brokers are able to bring in certain circumstances to our clients. The CEO of Northwell Direct was at the dinner with us, and hearing him, and his name is Nick Stefasani, and then Dr. Sandy Baldwin, who's their chief medical officer. Do you know Dr. Baldwin?
Not personally,
but you know who she is. She spoke that night at the dinner with us as well. And their relationship to the caring part of healthcare was, I don't want to say unbelievable. It was just so poignant to hear them talk about that wraparound service, which I think is what you're talking about, right?
That's great to hear.
Right, where somebody maybe is getting cancer treatment, and the nurses or the docs or the other folks around are bringing a warm blanket or bringing different things, because it's freaking scary, man.
It is.
Right?
It really is. Yeah. Cancer takes away your control. You're not able to dictate if you're that type of person that is a planner or likes to know what your day is going to look like, or likes to know how you're going to feel or how you're going to show up in the morning. It really takes away a lot of your ability to kind of, again, dictate your life, plan out your life, change your life. You're falling at the needs of whatever your treatment is or however you're feeling for the day. Yeah, maybe like you had it all tied up in a nice little bun, but guess what? not today. Yeah, not today.
Yeah, I get that. So how, in your role, with that background from working with Sloan here on Long Island, Memorial Sloan Kettering, And I heard you say revenue cycle management.
Right.
My friend Bert Lurch owns a company here on Long Island called ECM Medical Management. And so I understand that revenue cycle management, and the consulting with docs. Your background, how has that informed the work you do at PM Pediatric and further into community relations and community engagement and things like that?
I mean, I think, whatever role you're in healthcare right now, today, there's so many things that are changing. And we worry about the impact, whatever it may be, on all of our care and our access to care and people being able to get good care. In my role at PM Pediatrics, it's really important because it's kids, right? So they're not making a decision. They don't even know what's going on.
Right.
They're sick. They're coming in with a breathing problem or a fall or a laceration, and their parent just wants to get them care. And, their insurance may not be active or they may not understand their policy rules on why they have to make this deductible payment and all these big words.
Yeah. And all I want is my kid to feel better.
Exactly. That's going to say.
Yeah, right? And that's all I want.
Not the
I'm
thing.
freaking out. And,
Exactly.
and listen, I go to the emergency room personally when I feel chest pain. Other than that, I walk it off, right? Like that's the what.
Well,
all right. One time I was something in my stomach, I did finally go because my wife pushed me. But it's the ticker that that's the one that's not negotiable, right? All of us. Gang, if you're feeling chest pains, you go to the ED. There's nowhere else to go.
Yes.
Go to the emergency department. But it's just part of healthcare. It's a business. But the folks do, after you're getting settled in, somebody does come by to discuss billing.
Right.
And it's business. Things cost money. It's how this country works right now.
Right.
It's interesting though, like you talk about, folks are scared. They're bringing their child in, especially the one you talk about, like breathing. Like somebody's having trouble breathing. I mean, that's a scary thing. Yeah. How does the culture of your organization focus in on to make folks feel more comfortable?
So we have trained our staff to be able to identify patients as they walk in the door. If a child's coming in, even now as we go into the cold season, if they're wearing a coat, "Hey, Mom, Dad, can you take off the coat so we can see how the child's breathing, so we can see how the child looks?" If an appointment is scheduled and a patient's coming in for, a laceration or they need an x-ray, we're ensuring that we have the right clinical staff on site to be able to see patients. And we've recently expanded our hours. I mean, the name PM Pediatrics, right? Not even a couple of years ago, our offices were open in the evening.
I remember.
We were catering to an after-school crowd.
How late did it go in the past?
So previously in the past, it was originally 4 p.m. to midnight.
Okay, yeah. That's what I remember, when there was one right out here on, where am I looking? Up here on Northern.
Northern, right.
Yeah, in Manhasset.
Yes.
I remember that was legit, my word, PM. That was where you went when other spots were not there. So you didn't go to the emergency department for unnecessary reasons, right?
Right. So we've responded to the community. We responded to the ask. We responded to the need. So we have offices open at 7 a.m., 8 a.m., and we have offices open until 11 p.m., 12 midnight. That's
great.
So, we're an alternative to the ER. It's a lot better access a lot of times, than going to a hospital for care. A lot of times we pride ourselves in being a lot faster with throughput to be able to really identify the problem. You spend hours in an emergency room. And, again, by all means, you need to go to the emergency room, you go.
If that's,
right?
If you go to that place. However, being somebody who's in the insurance business, who sells these products, I know that the carriers are disincentivizing us to go to an ED if that's not appropriate.
Exactly it.
Because it's not. If that's not the spot you're supposed to.
Right.
Because that's why the emergency department would be overflowed with people because they're not using it appropriately.
You hit the nail on the head. Yeah. Exactly with that. So, we're able to see patients. A lot of times, going back to the financial thing, the coping is a little bit lower opposed to going to the emergency rooms. But again, if you're coming in for something like, a sniffle or a flu, or you need want to be tested for COVID or RSV or whatever is going on, we can do that. We can do that quickly. We can do that accurately. We have amazing physicians in all of our office that can really treat people well. Yeah. So your role, as we talked about, and part of the reason why I consider what you're doing change-making is getting involved in the community. Yes. And what we said earlier on the mental health side of things, but even before we got started too, schools, libraries, right, community centers. Tell me
you said, how many locations? Did you say 12? Like
There are 7 here on Long Island.
7 here, and that includes Queens, or?
It does not include Queens.
Okay, so you mean Nassau, when you say Long Island, you mean proper Nassau, Suffolk, 7.
Correct.
Okay.
Right. 3 in Queens.
Okay.
So Belrose, Bayside, Forest Hills.
Okay.
And then we also have Bensonhurst, Brooklyn, and then Staten Island.
And how many? One in Staten Island?
One in Staten Island.
Does that round off your 12?
That rounds off my 12.
Got it. All right, so in your role, talk to me what that's like to go out and get involved in the community and who you need to meet with. So, because I know a couple people, man, so maybe I could help.
That's great. You know, we really just want to position ourselves as the place of choice for pediatric urgent care. Again, there's urgent care facilities out there, but we can really treat your kids. We know your kids. Our physicians have specialized training in actually seeing pediatrics and can identify maybe some things that, you know, maybe not able to be identified in an urgent care center that specializes in primarily adults. That's the beauty of having specialized urgent care. A lot of my role is being able to go out into the community and really spread awareness of what we can do and that we're here. As, you know, representatives of PM Pediatric Care, we are in no means trying to take away the volume from your pediatrician. We encourage patients to go back to their pediatrician. We want to build those relationships.
So you want to build relationships with pediatric practices. So that's great to know. Good.
Yeah, we are sending the note back to your primary care physician, encouraging patients to follow up with their primary, to, you know, keep those bonds, because primary health care, as we all know, you know, the checkups and things like that are extremely important as well.
No doubt.
So we are there to fill the gap for any urgent care, any sick needs that may arise. But as you mentioned, what's important to me is just community work in general, just as a person and just as a human being. So outside of my role at PM Pediatrics, it's just important for me to connect with people. I really believe in networking and connections. I think we all have a value that we can bring to each other in like the weirdest ways. I mean, again, like we literally just sat next to each other at a lunch function. I've never met you, you've never met me. And, you know, we were able to connect on various, you know, different things. And, you know, it's all about awareness too, right? Sometimes you don't know what's out there. You don't know what's good, what's bad. You know, a lot of things in our life are about referrals and things like that.
I mean, word of mouth, man. You know, I over the years got involved with some different like network marketing or multi-level marketing things. And for whatever people think about those things, I understand. However, the concept of word of mouth marketing is like referral stuff. It's what it is. It's like, hey, listen, I'm coming through, I'm going to be in Lake Success. Do you know where I can get a smoothie? Or I got to get my shoes shined. I don't really wear dress shoes all that much anymore, but when I used to, I would need to find out, or where you're going to get a haircut. I just wear a hat and cover up my hair. But, you know, but that's how we get a lot of things in life. It's like, hey, what do you think? Where do you go? And that's the same with what you're talking about networking and community development. I want to know about like nonprofit work that you might be involved, because I'm sitting here going, oh my God, you all need to know ECLI Vibes, which is an organization, a nonprofit that is on the forefront of protecting and servicing people who have been a victim of trafficking, right, or sexual abuse or these things. I think this is how my brain works. I think of my friends over at Bikers Against Child Abuse, who are going to be in studio with me, I think, in a couple weeks.
Oh, that's awesome.
They're wonderful organizations. I don't know if you've met these guys yet.
No, I've definitely heard of them.
It's an international. This group is Baca, Long Island. They were a finalist in the Long Island Imagine Awards. Wonderful men and women. And when a child is in an abusive situation, they'll come through, they'll take care of, you know, bringing the child to court. Amazing. They'll sit in the courtroom when the child has to testify. They have to go through, a friend of mine is a probationary member of the organization. He's going through like all the education that you need to go to be a member of this. And they're doing such great work for young people that my mind is going, oh my God, children. Who's helping children? And there's these different types of overlap. Has PM Pediatric, either locally or across the country, been very involved in the nonprofit sector and or even right here with the work you're doing? Yeah,
so I probably won't do it justice in speaking to all the great things that you know we're doing, but there is a lot of work being done just to to really reach out now at this point, and
Yeah.
I'm happy to say that, I'm involved in it. So personally, I can speak to, what I'm doing here on Long Island and Queens, which is, again, reaching out to organizations to see how we can help. Definitely getting involved in a lot of children's sports arenas, Sports Quest, schools, looking how we can sponsor.
I love that.
I just was on the phone this morning with one of the local school districts, like we're sponsoring notebooks for the school for this year.
Yeah.
So, just trying to do things on a much minor level personally, but I'm definitely also open to bigger things, open to other connections. It's really just bigger than, just, the healthcare itself. Again, it's about personally connecting with people, really being involved in my community. And I'm a very spiritual person. So just with that as well, just really making sure that, we're connecting in all different ways.
Yeah. Well, I one of my favorite words, well, there's a couple. One is Tommy D. But aside from that, I wish I was kidding a little bit. But my other favorite word is connection, and that's what you're talking about. And it's and I appreciate the spiritualness that you mentioned too, because like I think, I did my show. I did my show Philanthropy and Focus this morning, which is a show where I interview executive directors of nonprofits. And I was having all sorts of tech issues. It was like bad news, man. I was like in my attic. Wi-Fi wasn't great.
Of course.
I'm frozen. It's a live show.
Yeah.
I'm frozen. My guest is talking.
Yeah.
I'm like trying to grab my laptop. I took the second half of the show from my porch on my laptop. Nothing was like going my
look
way.
at how you pivoted.
And it's all good, dude. You just got to keep it moving.
Yeah.
And my guest was a gentleman named Steve McDermott from Smile Farms, which Smile Farms has these farms where they employ adults with intellectual developmental disabilities. They partner up with all these other nonprofits where they build these farms on the grounds of the other nonprofit. And then when they harvest, they make hot sauce that is sold commercially. It's just such a cool story, right? And that's all connections, because my friend who's been on the program with me, her name is Isabel Lendano. She's the program manager there. And we used to collaborate when she was at Best Buddies, which is another nonprofit. So I go on and on and on, because like, that's all it is. It's only connections. It's only relationships, If I don't get invited by a guy called Joe Forgione, from Cord Meyer, to a lunch that Queens Borough President Donovan Richards is speaking at in the back of the Ben's Kosher Deli, right? I don't meet you, right? And then you don't meet Ed Probst, and et cetera, et cetera, et cetera. And we're not sitting here. So like, I think about that a lot, and it's like, well, what if I didn't go? Or what if I didn't do? Like, I don't know if you ever saw that movie. It was called Sliding Doors. Remember that?
Yep.
So there's just like this thing, and that turns into like, is he fooling around? Is he not fooling around? There's a whole But the thing to me, I just take away from it is like, you miss the train, you make the train. What's
opportunity.
The difference, man? What could have been? So many things. It's two different paths, And I try to say yes to most things, because I don't know, because I don't know how to say no. That's part of it.
I don't know how you do what you do, which is amazing.
There's two of me. No, there's not. I'm just kidding. It would be easy. You would believe that if there was?
I would.
I got an award a couple weeks ago from an organization. Thank you. From an organization called Options for Community Living. I bring it up just to say, my wife was in the room that night, and a lot of people say, like, how do you do all these things? Like, not that I'm doing it's a heavy duty, but it's just time-wise. And I say in a lot of cases, it's because I have people on my team that are able to help me out.
That's
my wife is like the chief executive officer, and she is able to manage a lot of things so I can do the cool stuff I do in the world. It is great. Yeah, it's important. It's an important part of things. So what do you see connection for the future, and how can maybe folks plug in and get in touch with you as they might want to collaborate with what PM Pediatrics is doing?
Yeah, so Connection for the Future is just making sure that we are a face in the community, obviously a business and a company that you can trust. So we're doing a lot of local things that we currently have setting up. So I really urge people to stay tuned. So we're currently going to be doing some teddy bear clinics.
Okay, what's that about?
So yeah, that's pretty cute.
Oh my God, I'm glad I asked this question.
Yeah, so we're going to nursery centers, we're going to daycare centers. The parents are going to get a note home a day ahead of time. The child is to bring in their favorite toy, their cutest teddy bear, whatever. And we're going to talk them through like sickness, how the doctor's going to look at them for a visit, how the nurse is going to do. And, we're going to put Band-Aids on their teddy bears, and we're going to let them check the temperature on their teddy bears, or their
Do you know
toy.
who Doc McStuffins is?
Yes, I do.
Doc McStuffins.
Yeah, she's so cute.
It reminded me like Doc McStuffins, where she was like always fixing up her animals and teddy bears and stuff.
Yeah.
That's a great idea. I have many friends, but this particular friend, his name is Ray Moeller, and he founded an organization called the Little St. Nick Foundation.
Okay.
And when he was a little boy, he was like 6 years old, he had hip problems, and he had to go to the hospital.
Yeah.
And he had to stay in the hospital for 12 or 15 hours. But he got to leave. He couldn't understand at 6 years old that all these other little children had to stay there. Yeah. He now is like 28 years old. He founded the Little St. Nick Foundation when he was like 8 years old, 7 or 8 years old. And now they go to the child life centers of hospitals, and they give these bags of goodies and stuff, and they have these bag packing events. I think it'd be a cool connection for you all to know each other. Yeah, I'm gonna make that happen.
I'd love to.
I love that.
Absolutely.
How can we help you in any way? Anything else you need?
Just what you're doing right now.
Yeah.
Just spreading awareness, just ensuring that the community hears about us, because that's what we want to be. We want to be a go-to place for the community.
Yeah.
And, I'm always welcome to the feedback.
Yeah.
People can email me. You can call your local office and ask to speak with me. You'll be connected. You can call our corporate office, which is right here in New Hyde Park, and ask to speak to me or any of the leadership that we have. We're always looking for feedback. We're always looking to make sure that we show up in the right way for our community.
That's it, man. Business, doing good, connecting to community, man, that's my whole world. I appreciate it. Thank you for being here.
Oh, absolutely. Thank you for having me.
It was so fun, right?
Yes, it was.
All right, awesome.
Yeah,
I love
not bad. I made it through.
You made it through. We did it. I was worried. I don't know if I was going to make it through. I'm never sure if I'm going to make it through. Listen, folks, this show is called Long Island Changemakers. I'm called Tommy D because that's what I like to be called. The one and only, the nonprofit sector connector. This has been another In Focus production. It's all about community. It's all about relationships. It's all about networking. It's all about making the world a better place while you're here. I mean, if I can figure out a way to make it a better place after I leave, I'll do that too.
I love that.
This is another In Focus production. See you guys later. Bye now.